It's a great pleasure and honor to have this lecture dedicated to Andrea. During the last pandemic, in a year still dominated by COVID pandemic, intensive research has been carried out aimed at better understanding the interplay between SARS-CoV and HIV infection. In particular, beyond having jeopardized HIV prevention and treatment programs, we know that SARS-CoV-2 can lead to an aberrant activation of immune responses that can have a direct impact on HIV infection. At this regard, these two recent studies have found that in virologically suppressed patients, severe COVID can lead to transient increases in HIV RNA that can persist even after the recovery of SARS-CoV-2 infection. It is conceivable that such increases in HIV viremia can be explained by an enhanced T-cell activation caused by SARS-CoV-2 that can break latency and promote the reactivation of HIV replication. Although the clinical relevance of such increases in HIV viremia has not been defined yet, these results can pose the basis for larger studies aimed at understanding if such increases in HIV viremia can promote ongoing viral replication that can expand HIV reservoir, that can represent an inflammatory stimulus, and at the same time that can fuel the emergence of a drug resistance. Furthermore, during this year, intensive research has been carried out aimed at understanding the outcome of COVID in the setting of HIV-infected patients. Although at the beginning of the pandemic, no association was found between HIV infection and the severity of SARS-CoV-2 infection, these three studies, led in a very large sample size, have shown that people living with HIV are at higher risk to develop severe forms of SARS-CoV-2 infection. In particular, this study has shown that people living with HIV are at higher risk to contract SARS-CoV-2, are at higher risk to be hospitalized and to die for COVID. These results have been confirmed in this study by Anna Maria Geretti, showing that people living with HIV are at higher risk to develop COVID-related mortality, including individuals less than 60 years of age that usually experience milder form of COVID. These findings, overall findings, raise the crucial issue of SARS-CoV-2 vaccination in the setting of HIV-infected patients. In particular, so far, the efficacy of the currently available vaccines against SARS-CoV-2 in HIV-infected patients has not been defined yet. It is conceivable that, like other vaccines, the efficacy can be suboptimal. And this concept seems to be confirmed in this recent study, showing that people living with HIV who develop SARS-CoV-2 infection are characterized by lower titers of neutralizing antibodies against SARS-CoV-2 and more in general by lower titers of IgGs against the SARS-CoV-2, again reinforcing the need to define the efficacy of SARS-CoV-2 vaccines in HIV-infected patients and eventually to optimize the vaccination protocol in these patients. Beyond COVID, during this year, intensive research has been also carried out aimed at understanding the impact of antiretroviral treatment on the pathogenesis of HIV infection. And at this regard, I would like to share with you this study. This study was aimed at examining, at evaluating the levels of aging biomarkers during antiretroviral treatment. In particular, the kinetics of aging biomarkers were compared to those observed in a set of individuals not infected by HIV and matched for demographic characteristics. As expected, before starting antiretroviral treatment, HIV-infected patients were characterized by higher levels of aging biomarkers, indicating, supporting an acceleration in the aging process. Antiretroviral treatment was associated with a reduction in the levels of aging biomarkers. Interestingly, such reductions were comparable between the dual treatment and the triple treatment arm. However, the reversal of the aging process was only partial during antiretroviral treatment, suggesting the need to set up as soon as possible antiretroviral treatment in order to limit, to slow down premature aging and more in general HIV-related comorbidities. And indeed, during this year, different studies have addressed the benefits of early treatment. In particular, this study has the merit to have evaluated HIV reservoir during a long follow-up, in particular during 4 years of treatment. In this study, patients were stratified in the acute group, those initiating antiretroviral treatment within the first month of infection, the early group, those starting treatment within the 3rd month of HIV infection, and the deferred group, those starting treatment more than 24 months since acute infection. HIV reservoir underwent a biphasic decay. In particular, the first phase was characterized by a rapid decline that was particularly prominent in the acute group, but also in the early group. During the second phase, HIV reservoir continued to decline in the acute group, but also in the early group, supporting the long-term benefits associated with early antiretroviral treatment. Overall findings support that although we know the difficulty to diagnose HIV in the acute phase, however, these findings support the importance to promote HIV screening programs, particularly in individuals who are at higher risk to contract HIV infection, in order to set up as soon as possible antiretroviral therapy. The issue of early antiretroviral treatment has been intensively investigated this year in the pediatric setting. And at this regard, this French study has evaluated HIV reservoir in a group of children and in a group of adolescents. Each group was stratified. In the early group, those starting treatment within 6 months since birth, and the late group, those starting treatment within 24 months since birth. The authors found that a lower HIV reservoir was significantly associated, as expected, with early treatment, with protective HLA and, interestingly, with a lower cumulative HIV viremia, so with a lower exposure, a lower duration of HIV viremia since birth. During these results were confirmed in children, but also in adolescents, again confirming the long-term benefits associated with an early initiation of antiretroviral therapy. Another interesting topic addressed during this year is represented by the impact of co-infections in modulating the burden of HIV reservoir. And in particular, I have identified these two interesting studies published in Journal of Virology. The former was aimed at investigating the role of subclinical reactivation of herpes simplex virus type 2 in genital mucosa from virologically suppressed women. In particular, the authors found that the detection of HCV DNA was significantly correlated with higher levels of total HIV DNA, suggesting an enlargement in HIV reservoir. This enlargement, as we have seen for COVID, can be explained by an enhanced T-cell activation promoted by herpes simplex virus type 2 reactivation. Interestingly, the detection of HCV DNA was correlated with an increased genetic variability, presumably reflecting an ongoing viral replication that can pose concerns for an increased risk of HIV transmission. These results have been confirmed in the latter study, showing that the detection of CMV or EBV DNA was correlated with an increased HIV molecular diversity in PBMC, again reinforcing the role of co-infections, particularly by herpes viruses in modulating, in fueling HIV reservoir. As a final point, I would like to address the issue of PrEP. The issue of PrEP is crucial, considering that in 2020 there has been a considerable amount of new HIV diagnoses, largely exceeding the 2020 UNAIDS target. The issue of PrEP has been extensively investigated during the last CROI. In particular, this French study has evaluated the incidence of HIV infection in MSM, taking oral or on-demand PrEP based on TDF plus FTC. Considering a follow-up of 22 months, HIV incidence was 0.11 per 100 persons a year, corresponding to just 3 cases in each arm and corresponding to a substantial amount of prevented HIV infection. However, an aspect that should make us reflect is represented by a higher incidence of sexually transmitted infections and a higher incidence of viral hepatitis, in particular HCV, observed during the follow-up period in the overall population, supporting the importance to promote the screening for this type of infections. What about the future of PrEP? We know that long-acting antiretroviral agents can represent a promising approach for the prevention of HIV infection. In particular, during the last CROI, the updated results of the HPTN study have been presented. The study shows that long-acting cabotegravir is superior to daily FTC plus TDF in preventing HIV infection. In the TDF plus FTC arm, the transmission of HIV infection was mainly related to a decreased adherence to a suboptimal drug concentration that have favored the transmission of drug-resistant strains. An interesting result is that the use of long-acting cabotegravir is associated with a delay in the serological diagnosis of HIV infection, supporting the use of HIV RNA for a prompt diagnosis of HIV and in turn to promptly set up antiretroviral treatment, crucial to avoid the emergence of drug resistance. A different scenario was observed for the monoclonal antibody VRC01, whose efficacy was strictly modulated by the extent of genetic variability in GP120 that we know is very prone to accumulate immune escape mutations. And these results suggest that the success of this preventing approach should rely on the use of a combination of monoclonal antibodies, crucial to overcome the issue of HIV genetic variability. And finally, following the interest in messenger RNA vaccines raised by the COVID pandemic, we do hope that this approach can represent a promising strategy also to prevent HIV infection, as suggested by this study preliminarily showing the induction, the consistent induction of specific polyfunctional antibodies in macaques vaccinated with messenger RNA vaccine. So, in conclusion, despite the difficulties imposed by COVID pandemic, the scientific community has reacted and has provided new insights, new advancement in different fields of HIV infection, and we do hope that the pandemic will offer new opportunities, new point of view to further improve the management of HIV infected patients. And I thank you for your attention.